Welcome to the author interview series for the AASLD Clinical Liver Disease Journal. My name is Sutat Liangpansko. I'm a professor of medicine in the Division of Gastroenterology and Hepatology at Indiana University School of Medicine. I am a co-guest editor with Dr. Brian Lee from the University of Southern California for CLD Alcohol Use Disorder in Alcohol-Associated Liver Disease series. It is my pleasure to introduce Dr. Jennifer Flemming, an Associate Professor of Medicine and Public Health Sciences, Department of Medicine at Queen's University in Canada. She joined us today to discuss her article on culture, stigma, and inequities, creating barriers in alcohol use disorder management in alcohol-associated liver disease. Dr. Flemming, thank you so much for joining us today. I have a couple of questions for you on this interesting article, a very important area on how we can do better in the management of alcohol use disorders among these ALD patients. First, why should clinicians be aware of the diagnosis and treatment of AUD in patients with ALD?
Great, thank you so much for the invitation to talk today. So I think that one thing that is sometimes confused in management of patients with ALD is whether or not they have underlying alcohol use disorder. Because in order to be at risk of alcohol-associated liver disease, that's really based on the quantity of alcohol that's consumed to put you at risk of disease. But alcohol use disorder is actually a DSM-5 diagnostic category in and of itself, because alcohol use disorder does not relate to the amount of alcohol consumed. It relates to the behaviors and the consequences surrounding the alcohol use. And so not everybody with alcohol use disorder has ALD, and conversely, not everybody with ALD has alcohol use disorder. But if you have alcohol-associated liver disease and alcohol use disorder, there are specific treatments for the underlying AUD, and that's why it's so important for us to recognize AUD in our ALD patient population.
Thank you. So, having said that, what are some barriers to identifying and treating AUD for hepatology providers?
I think first and foremost, there is not a systematic way that hepatology providers are taught about alcohol use disorder. It's not regularly part of the curriculum, and therefore clinicians may not feel comfortable with identifying it. They may not feel comfortable with what to do once they have identified it, whether or not that's referring to somebody else or if that's for treating the underlying alcohol use disorder themselves. So I think that that is one major barrier from the provider standpoint.
Thank you. And in your practice, what special barriers to AUD treatment that are experienced by the subgroups of this ALD population?
So I think there's many different barriers for treatment of underlying AUD. So typically the treatment of AUD is a combination of both pharmacologic as well as behavioral therapy. So there's barriers in both of those incidents. In order to participate in behavioral therapy, people need to be able to get time off of work and have the ability to leave their home if they are caring for children or dependents. There is insurance or financial considerations as well, both for pharmacotherapy as well as the behavioral therapy. A large proportion of individuals who have ALD also have underlying comorbid mental health or substance use issues, which can affect their ability to participate. Because of the diversity of the ALD population, there's also cultural or language-related barriers that can occur, as well as a lack of understanding of the benefit of AUD treatment, or because individuals with AUD and ALD feel stigmatized by either their friends, family, or society. So those are just a couple of the barriers that these patients unfortunately face.
Thank you. So last question. So what should be your take-home message on how can we as a medical community start to remove these barriers to AUD treatment for such patients?
That's a really great question. And I think we're just kind of at the tip of the iceberg here of how we can help these patients. So from a provider level, there's things that we can do for our own continuing medical education to become more comfortable and familiar with the diagnosis of AUD as well as the treatment. From a hospital perspective, the availability of AUD treatment services for the ALD population should be a priority, and that there should be equitable access to treatment, especially for these vulnerable populations. From an academic standpoint, I think that we need to start to design studies which specifically look at the efficacy of AUD treatment among individuals with ALD. And then from a societal level, we need to be able to start reducing the stigma that's associated with AUD and ALD so that our patients feel comfortable disclosing this information as well as participating in treatment.
Well, thank you so much. And on behalf of the guest editors and the CLD team, thank you so much again, Dr. Flemming, for your time today. I think for more information about this topic, please refer to the full article by Dr. Flemming on the AASLD website on clinical liver disease on the alcohol use disorder in alcohol-associated liver disease series. Thank you so much for your time.
Thank you so much.